Go.
I'll come into the patient's room and introduce myself. I'm CJ Larez. I'm a student nurse here at the College of Nursing. I'm going to be performing care on your central line. I have the order to do routine central line care per unit protocol. I would check the hospital policy. I would gather my equipment and I would perform hand hygiene. I would then identify the patient using two identifiers: the name, Jones Jaguar J, the medical record number, which is 4176352. 4176352. I know this patient does have an allergy to penicillin, and then I would provide the patient with privacy, and while maintaining the patient's privacy, I would inspect the central line and I would palpate around the central line with the dressing still applied. I would then position the bedside table closest to the patient, and I would position the trash can, and I would perform hand hygiene. The next thing I would do is I would position the bed to a comfortable working level, lower the side rail, and I would position the patient for comfort with slightly elevating the head of the bed. I would now open my kit. And I would open only the first part, exposing the mask only. I would put on the mask and my goggles. And for the purpose of this video, I will not wear the mask. And I would also assist the patient with the mask. And next I would apply clean gloves. And I would remove the old bandage, the old tegaderm. I would pull the tegaderm from the outer part inward, and I would remove the bio patch, and I would put the dressing into my glove. And while exposing this, I would observe for any observable complications. I would then remove my gloves, and while in the dressing, glove to glove and skin to skin, I would perform hand hygiene. Now I will open my kit, and I will open my kit only touching the 1-inch border of the kit, of the drape. And I will now don my sterile gloves. I'll now arrange the contents in my kit. And whenever I removed the dressing, the old dressing, that was whenever I would get the culture, if indicated. I will now clean the central line. I will first clean with alcohol. I will keep everything above waist level. Whenever cleaning with alcohol, you clean from the inner part out, never touching the same, going over the same spot, and making sure to go wider each time and not touching the central line. Now I will clean with ChloroPrep. Whenever you're cleaning with core prep, you want to clean vigorously, and you want to clean horizontal and vertical. And you want to clean for 30 seconds. Whenever cleaning with core prep, you also want to clean the catheter insertion site and the catheter. You want to allow that to dry. Next, you want to apply your bio patch, and you want to make sure that you have the blue side up. Next, you want to apply the Tegaderm. After that has dried, you want to make sure you're not touching the Tegaderm with your contaminated hand. You want to apply the Tegaderm onto the site. You also want to preserve the label on the site, and you want to apply the label with your date, time, and initials, and apply it onto the patch. You then would want to remove your gloves and you would want to remove your mask and the patient's mask. You would want to perform hand hygiene. You would want to position the bed to the lowest position, raise the side walls, position the patient for comfort, make sure the patient has all the necessities, make sure the call light is in reach. You then want to dispose of your supplies. And then you would want to perform hand hygiene. And then you would document the site of appearance of the catheter, the drainage, with the amount and the consistency. You would want to note the type of cleanser you use. You would want to note the type of dressing you use. You would want to know the patient tolerance, and you would also want to document the date, time, and your signature.